So the COVID case numbers are through for Victoria and they are not what people would have been hoping for. There are going to be developments through the day in New South Wales, Victoria and the ACT. We'll keep you across it all here on the ABC News channel. Let's head straight to Victoria because these numbers have only just come through. Reporter Eden Hennanen joins us now from Melbourne. Eden, take us through what's happened.
Good morning, Joe. Yes, as you just mentioned, the figures did come in a few minutes ago and it's pretty disappointing, I must say. Victoria recorded 80 locally acquired cases over the past 24 hours. Now, 67 of those cases are linked to previous outbreaks, but only 39 were in quarantine during their infectious period. Now, that makes 600 active cases across the state, and really we're hoping to report today that numbers would continue on that downward trend. Yesterday we saw 45 locally acquired cases, the day before 51, and the day before that was 71. So it was looking like it was going on the downward trend, but I think it just proves that the numbers of mystery cases and consecutive days of those not in isolation during their infectious period is maybe what's seeing these numbers increase today. There are more than 800 public exposure sites now across the state, and overnight we heard that there was a waiting room at the Monash Hospital in Clayton was initially listed as a Tier 2 site, but overnight it went to a Tier 1 site. And a high-rise residential tower in Fitzroy was also labelled a Tier 2 site yesterday. So authorities are urging anyone at any of these 800 exposure sites or anyone linked to these locations to make sure they get tested if they do have any symptoms. Now, in some more positive news, vaccination rates are on the rise. We heard yesterday that almost a third of Victorians have had both doses of the COVID-19 vaccine. And in some nice news, yesterday we had a chat, Joe, that I was heading along to the vaccination hubs where there were long lines of those over the age of 16 getting their Pfizer or AstraZeneca vaccine at these state hubs. We heard that there were 1.3 million calls yesterday for those interested in getting the vaccine at these state-run vaccination hubs. And 100,000 appointments were made yesterday. So that's some positive news there. Also, Joe, we've been hearing about the burden on the health system here in Victoria. Lots of hospitals across Melbourne have been affected by clusters or Tier 1 or Tier 2 public exposure sites, including the state's largest hospital, the Royal Melbourne Hospital in Victoria. So because of that, yesterday it was announced that 350 overseas workers will be coming in to help ease the burden on the hundreds of workers that have been permanently or let go for a short period of time. So at least we'll get some positive news there and relief for some of these workers who have been really hit hard during this pandemic.
And Eden, what's the situation like in regional areas in Victoria?
Well, of particular note, in Melbourne, in Victoria's north, in Shepparton, the cluster has reached 50 cases. Now, we've just had the new cases come in today across Victoria, that 80 cases, new cases, 67 are linked and 39 in quarantine. Now, we're not sure how many of those are linked to this cluster in Shepparton in the state's north. But we do know that more than a third of the population in Shepparton has been put into lockdown. Now, you can imagine the burden that's putting on the state's supermarkets and local businesses. So more cases are expected to come through today, but we do know that 50 defence personnel have been directed to go up to Shepparton to help ease this workforce in northern Victoria. Now, Shepparton Mayor Kim O'Keefe spoke a short time ago about the plea for help, basically, to help Shepparton.
We need immediate support. We're doing the best we can, but we know there's families that, it's taking time to get to them. The supermarkets are needing help as well. They're needing support. They're needing online support. We're getting more trucks apparently coming in from some of the other supermarkets for more deliveries. So it's something no one has perhaps ever seen before as far as the sheer amount of numbers in one community. It's very hard to manage, but as I said, we're just putting our, a hand up, doing the best we can, but also reaching out and saying, please give us more support.
So, Joe, a plea for help there from the Shepparton Mayor. Things aren't looking too good in Shepparton today. They said those 50 cases will likely increase today from those 80 new cases listed across the state. So we'll update that when we can.
Yeah, it's amazing, that statistic there. A third of the population in Shepparton in isolation at the moment. OK, Eden Hennanen reporting there from Melbourne. And so obviously with those figures just coming through from Victoria, there will be a lot of people keen on seeing that Victoria Media Conference when that happens today. We'll keep you across all those media conferences through the morning. They generally happen in the 11 o'clock hour, that's 11 Eastern time, and we'll bring you them live on some ABC platform. I'll talk you through that when the time gets closer. In New South Wales, the strain continues to show on the health system, with hospitals taking measures to deal with increased demand. Before we go to our report, let's take a quick look at what's happened with the case numbers over the past couple of months in New South Wales. So yesterday, the worst day for new cases, a big jump to 919 and 2 more deaths, taking the death toll from this outbreak that started 2 months ago or 10 weeks ago to 76. The yellow portion on these bars are those confirmed to have been in the community while infectious, and you can see a relatively small portion of the case numbers there, but the red portions of these bars are the cases where officials just had not worked out by the end of the day if the cases were isolated during their infectious period or not, and that number continues to be in the several hundreds. By far the most cases are still popping up in Western and Southwestern Sydney, 2/3 I think it was yesterday, but the numbers are growing in the far west of the state, or the west and the far west of the state too, with Dubbo of particular concern. Okay, let's go to reporter Lara Himes now in Sydney. Lara, g'day. So the health system is struggling in New South Wales. Take us through what's happening.
Good morning, Joe. Well, there's been huge demands put on the health network, especially given that 80% of our ICU beds are already taken up and 17% of that figure are taken up by COVID patients. We know that in response to that, hospitals have had to take drastic measures to deal with the influx of patients. So at Westmead Hospital, this is the hospital located in Western Sydney where there is a high caseload of COVID patients. They've had to set up a makeshift triage area to help facilitate the increase of patients there. We do understand as well that this directive came a day or so after staff at Westmead Hospital were told to brace for diversions and also to engage the private health network. So we understand that there are about 100 beds which would be set up in conjunction with the private health network. So as Westmead staff were told about that, Association. They are the union representing ambulance workers. They have been telling us over the past week or so, telling cases of ramping, and that basically what that involves is that their ambulance officers waiting for their patients inside to get a bed. We understand that ramping was happening last night here at Concord Hospital, where patients were waiting several hours to be seen to. However, the message from New South Wales Health has been that if you do need critical care, still go to a hospital, although it's unclear where you will be transported to if you don't remain there. Now, we've also heard New South Wales Health try to promote the message of vaccination. They've taken one step further and have shown video of COVID patients who have been impacted by the disease.
It takes its toll on you physically and mentally, this virus. Like, it's not just a physical. I've had 2 kids, I've had a major operation, I've never had to recover or push myself to try and recover, like, mentally this much.
It was harsh. There was fever, there was headaches.
So please get vaccinated. I wish I did it beforehand.
Some of the hundreds and hundreds of New South Wales residents there who've been hospitalised through this outbreak, which began 10 weeks ago. And Lara, the lockdown has been in place in that Greater Sydney area for about 8.5 weeks, I think it is now. Gladys Berejiklian had held out the hope that at least one restriction or some restriction could be eased once the state got to a particular point with vaccinations. What's happening around that?
Well, a lot of speculation about what that would actually involve. So this was coming as basically a reward for us in New South Wales and Sydney reaching that target, that 6 million dose, that vaccination for Sydney-siders and also New South Wales. The goal was to reach it by the end of August. Seemingly we've done that with a week to spare. The reward was to have some kind of flexibility with some of the restrictions. Now, we don't know whether or not that is going to pertain to gatherings or whether it relates to businesses opening opening up, but it's likely that that may only be accessible to people who have received the double dose. Now, with that cohort, there's only about 30% or so that stand at that double vaccination level at the moment. So whether or not there's going to be an easing of restrictions in some form, it's only going to be a limited group. So the implementation of that is likely to be rolled out over the coming weeks. We understand as well that Crisis Cabinet met last night. One of the other discussion points has been when face-to-face learning is going to resume at schools. So we're likely to hear some update about that tomorrow. But we do know as well that there has been an extension of the Job Saver program. This is the subsidy program for businesses that was bankrolled by the New South Wales state government. This is for businesses that had a turnover revenue going up to $250 million. We understand that that is going to be expanded to businesses that now have a bottom line of about $1 billion. So some improvement and welcome news for the business community.
And what's happening in regional parts of New South Wales?
Well, we know that this has been a huge issue and some pressures being placed on the public health system there. In terms of the figures that we were getting, there have been several local health districts that have got some concerns with COVID. So if we have a look at some of the figures from yesterday, we do know that 49 cases were from the Western New South Wales area. That also expands 7 in the far west, 8 from the Illawarra Shoalhaven further south, 4 from the Hunter and 1 from the Central Coast. Now, if we add all those case numbers together, that comes to 69. That makes up nearly 8% of the total number of COVID cases. So in the western area where Dubbo is, we do know that there's now 110 areas of concern. 1 in 173 people have COVID in Dubbo.
Okay, Lara Himes reporting there from Sydney. The ACT has seen a promising drop in cases, but the government says it's unlikely the lockdown will end next week. There were 9 new infections yesterday, bringing the total outbreak to 176. While the number is low, only 3 were in quarantine for their entire infectious period. 4 spent time in the community, and the isolation status of the remaining 2 is under investigation. Reporter Lisa Glenday joins us now from Canberra. Lisa, what's the latest?
Good morning, Joe. Well, today marks 2 weeks since we learnt that COVID-19 had returned to Canberra, 2 weeks since Canberrans have been in lockdowns. We now have 176 active COVID-19 cases in the community, and that's after 9 new cases were recorded yesterday. The 9 new cases is an improvement on the 30 new cases that were announced on Tuesday, but the Deputy Chief Health Officer has been keen to stress that it's too early to say yet that we have a downward trend, so we'll have to wait and see what those figures show again today. 8 of those 9 new cases are linked, which is good news. 1 is still under investigation. Of those 9 new cases, we know that 4 spent time infectious while in the community. We've got 7 people who are being treated in hospital. We've got a Canberra woman in her 40s who is on a ventilator in intensive care, and we know that she is in a critical condition, and we also know that she wasn't vaccinated. There's also 10 cases now linked to a childcare centre in Canberra's north. That was 3, so we've had 7 new cases added to that cluster. We don't know the ages of those people, but we do know that it is a mix of children and adults. The list of exposure locations continues to grow. But in some good news today, we only had 3 new exposure locations added overnight. We've got 2 supermarkets and a bottle shop, so they are what is considered essential services, and the periods of time were quite short. So the ACT Health Minister says this is a sign that the lockdown really is starting to work.
And what's happening with the lockdown?
So we are in lockdown for 1 more week at least, so until the 2nd of September. And the Chief Minister, Andrew Barr, said yesterday that we won't be coming out of that lockdown early, which I don't think will come as a surprise to anybody. I don't think anybody was expecting that we would come out early. If anything, we're thinking that it could potentially be extended. But they are considering some changes to the lockdown rules for next week. This is not going to be an easing of restrictions, we're told, but rather a rebalancing. So after getting some feedback from the community, there are potentially some things that Canberrans might be able to do that is not going to put a huge strain or a huge risk to the community. For example, we know that the rules around accessing IVF treatment are going to be relaxed during Canberra's lockdown as some of these changes start to come through. So we'll know a little bit more detail when the Chief Minister gives his update at 11:45.
Okay, Lisa Glenday reporting there from Canberra. Let's head north now. The Northern Territory has announced that anyone over the age of 12 in the Territory is now eligible for the vaccine. It comes as COVID restrictions prepare to be lifted in Greater Darwin from midday. Restrictions including a mask mandate and caps on the number of visitors in homes will be lifted. Gyms and markets are also set to reopen. Anti-Health says restrictions for the Katherine area will be reviewed again this morning. New Zealand is struggling to get on top of its COVID outbreak. The number of cases linked to it stands at 210 now. TVNZ's Zion Dale reports from Auckland.
Look, yes, definitely a big jump in cases. Yesterday, New Zealand recorded 62 new community cases. That's the most in a single day since this outbreak began, bringing our total to just over 200 cases. The main concerns is identifying those close contacts and also seeing how far this virus may have spread. Over 400 locations of interest have been named all over the country, but the majority of those are here in Auckland. Testing centres around the country since this outbreak have been inundated with people. Our vaccine rollout has been a bit slower than anticipated, but it seems that this outbreak has kicked a lot of people into gear. Just yesterday, 80,000 people got a dose of the vaccine. That's the most in a single day. In the words of our COVID response minister, we're not ready to throw in the towel yet. Look, since this initial lockdown, the government has been extending this alert level 4 around the country for about 3 or 4 days at a time. They aren't giving up on eliminating the Delta variant from the community, but the Director General of Health, Dr. Ashley Bloomfield, said it is encouraging to see that these cases are steadily rising and not astronomically rising. The Prime Minister also saying the aim of this lockdown is to get this Delta variant out of our community, and it is the safest way to do so while Kiwis are getting vaccinated. Again, to what Chris Hipkins said, he doesn't want to throw in the towel yet. We've come too far. It's almost been 2 weeks since this level 4 lockdown, but this is what he had to say at the latest press conference.
Nobody wants to be in lockdown, and the best way that we can return to enjoying the freedoms that we have had for much of the last year is to get very high levels of vaccination. So we do need to shift from things like our border restrictions and lockdown measures being our main lines of defence to vaccination being a much bigger collective defence against the virus.
And just on New Zealand's lockdown for areas outside of Auckland, an announcement is due to be made on that tomorrow. But for here, for us in Auckland, we'll be in alert level 4 until Tuesday, with an announcement expected on Monday.
Zion Dale reporting there from New Zealand. Turning now to the COVID situation in regional New South Wales. Reporter Xanthi Gregory joins us from Orange in the state's Central West. Xanthi, g'day. So what's happening with the numbers there around Orange area?
Morning, Joe. Look, we've heard from the state's Transport Minister Andrew Constance this morning that regional New South Wales will not come out of lockdown as planned this weekend. That's because state case numbers and sewage detections of COVID-19 in regional areas have just not dropped. Here in Orange, where I am, there's 6 active cases at the moment, and the concern there is that the majority of them were infectious while in the community. So Orange is part of the Western Local Health District, which spans from Bathurst all the way out to places like Burke and Brewarrina. But the epicentre of the outbreak continues to stay in Dubbo. So yesterday, 49 new cases were recorded in the local health district, which is a record high in this outbreak. There's nearly 400 cases and 80% of them are in Dubbo. And one of the major concerns is the far western local health districts, so places like Wilcannia and Broken Hill. There's now 49 cases there. A lot of those cases are linked to a funeral that was held before the public health order and the restrictions were put in place. So about 40 of those cases are there, and that's being called a bit of a super spreader event. But we're definitely not seeing any reprieve in terms of numbers.
Yeah, and why do authorities think the cases they're not getting on top of what's happening in places like Dubbo?
Yeah, so all of regional New South Wales has been in lockdown for about a fortnight now, Dubbo about 3 weeks at this point. But yeah, as I mentioned, record cases, the 2 consecutive days of record cases. One of the biggest concerns is that about 20% of all cases every day that are being recorded have no transmission. So it's causing a lot of concern for contact tracers. They actually can't link the cases, and testing rates are another bit of a worry for the local health district. I'm standing at a testing clinic in Orange right now, and there's absolutely hardly any cars here. There are about 6,000 tests that were conducted across the local health district yesterday, but authorities want that to be double. Another problem is vaccination rates. So while they have increased with mass vaccination hubs by about 8% over the past fortnight, so about a quarter of the population here are now vaccinated, the Aboriginal community in Western New South Wales is only sitting at about 6% vaccination rates as well. So there are a lot of risk factors at play, and the case numbers are expected to rise before they fall as a result.
Okay, we'll leave it there. Xanthi Gregory reporting from Orange in the central west of New South Wales.